Good evening and welcome to the 5th Government Plan virtual debate. Tonight our focus, rather timely, is all about how we are responding to COVID. On a day when we've heard firsthand how the vaccination programme is going to be unravelled in the island and rolled out across all the different age groups and sectors, but also on a day when we've learnt that the number of active COVID cases has reached 200. We've got lots of questions to ask, and I'm sure you've got plenty more. So, how can you get in touch with the debate tonight? What you need to do, first of all, the easiest thing to get a way of getting involved is to log on to Slido. If you're not sure, just Google it, Slido, slido.com. When you go on there, you don't need to enter your personal details, you don't need to log in. You simply enter the code GovPlan2021. GovPlan2021. You'll then be able to ask a question. It will appear anonymously. You can put your name on it if you like, and then that question will come through to me on my laptop here, and I'll be able to put it to our guests in the studio here in St Helier this evening. Having watched a few of Gary's. When Gary's been in the seat here this week, I've been watching them on Facebook. A lot of you are posting questions in Facebook. If you've got the chance, hop over to Slido, pop them in there. It's a lot easier, and they'll be picked up by the people sitting behind the camera here. So, before we introduce the panel and start putting our questions to the ministers, I'd like you to take a look at this video from the Health Minister.
One of the ways we'll be protecting the island's future is by responding to the health and well-being challenges of COVID-19 and protecting our health services. We'll continue to protect islanders' lives and livelihoods by providing support where it is most needed and suppressing the virus until a vaccine can be provided. While this will put all areas of government under unavoidable financial pressure, be assured that funding in the Government Plan 2021 to 2024 will be targeted at those essential public services that are responding to the pandemic, such as maintaining the Test, Trace and Contact programme, continuing to fund the Nightingale Field Hospital through to at least March 2021, making sure we can effectively and efficiently distribute personal protective equipment as and when needed, funding the provision of a COVID-19 vaccine when it becomes available. In addition, in this government plan, we will also be supporting islanders' well-being and mental and physical health with a range of measures, including continuing to deliver a range of preventative and proactive schemes focused on inspiring an active Jersey, significantly improving access to mental health services, implementing a digital care programme focusing on replacing outdated systems, continuing to expand our 24-hour community nursing and primary care services, and implementing the Jersey Care model that will enable a move to a more preventative health service.
Okay, so we've just heard there from the Health Minister about how we're going to respond to COVID in the future. I'm glad to say he's with us here this evening, but let me introduce the panel. First of all, we've got, for his 5th night in a row, a very tired, I'm sure, Chief Minister, Senator John Lafondre.
Good evening.
Further along, we've got Health Minister Richard Renniff.
Good evening. And
at the end here, we have our Home Affairs Minister, Constable Len Norman.
Good evening.
So let's kick things off. Health Minister, as you said in the video there, we're going to continue expanding the health service. We're going to invest in the Jersey Care model. How are these things going to help us tackle COVID in the future?
COVID in the future, it may be that COVID will be with us as something we need to deal with in the future, but if we have a vaccine available, like flu at the moment, we would be in a position to meet that issue year by year if we have to. There's some uncertainty as yet as to whether COVID is hanging around and becomes an annual thing. But we must understand how so much learning has come out over the past 9 months. If this does become something that's permanent, we'll be able to deal with it, because the whole of the medical world has really stepped up in these last 9 months and, given us the tools to deal with this and carry on with our community life as much as we can.
And what sort of strain has this put on your department?
Oh, it's put an immense strain on hospital services, mental health services, and I give great credit to the staff working in those, because they've really gone above and beyond the call of duty, because they are so dedicated, and we've got to thank them for that. But it has taken a toll on people who felt exhausted, and that is why it's so important that we follow the public health guidance and try and keep the hospital admissions low, so that staff have time to deal with the normal business of running a hospital and serving in a hospital.
So, Chief Minister, just on that, following the guidance, obviously there's two big stories today. There's the rolling out of the vaccination programme, but also we've now hit 200. It seems to be a bit of a milestone figure. I mean, are we losing control in our community of this virus?
No, not at this stage. And I think it falls into two categories of answer. One is, as we know, it's very much down to the responsibility of the community and how we all act, and that's particularly going forward over the next few days and the next few weeks. I think the other point to remember all the way through this, particularly trying to do comparison to where we were in March, our testing regime is so far advanced and our contact tracing regime is so much improved that what we're doing now, it's always been about hopefully speed of reaction, that even if what we're doing is, particularly with this cluster that's been identified over the last few days, is the speed of tracking them down and putting those individuals into isolation, hopefully then to stop that further spread.
So is this extra rise, do you think, because of that same cluster?
At the moment, so there's two strands of the rise. There is what I'll call an underlying rate of infection that's been sort of bouncing along at a certain level for the last, certainly for the last week or so, to an extent up to, I think it was Monday evening, we're actually seeing the numbers almost stabilising / going down slightly. What's then happened is, as a result of what seems to be, it's been classified or classed by some people as perhaps being one event. It's slightly more complicated, that it would seem at the moment, where more than one venue may have been involved, and that's again what's being established as about getting to the facts of what has actually happened. My understanding is that people were following the guidance actually to date. That's what we've now again get to the facts, see what's happened, but essentially for whatever reason, which we've not yet established, is that there does seem to be a number of positive cases that are coming out of this. But don't forget, as again, now that we're identifying it, we're testing them swiftly, we're getting the results back swiftly. I think the average was now between 7 and 9 hours, and that means again that we're reacting appropriately.
So obviously when we get clusters like this, or we get breakouts of the virus, the track and trace program kicks in.
Yep.
It tries to track people down literally and get them to lockdown.
Yes.
I mean, are we happy, or are you content that in this instance all the people that may have come into contact with these people have been found, they're not still mingling in the community and spreading it further?
Well, I think this is where the contact tracing regime comes into its own. So essentially they'll have been going for, perhaps Richard might want to comment in more detail, I suspect, but as I understand it, they essentially track down the kind of key people initially at the event. They then track down their direct contacts quite swiftly, and obviously what you're then dealing with is other people in the periphery. But it is quite a complicated process, and in fact States members had a briefing back in the summer on how it evolved. There's some software behind it, and it has really evolved into quite a sophisticated process. So it's all about risk. So have we identified everybody at this stage? I don't yet know, I have to say. But the point is we are identifying as rapidly as we can, and you get the initial contacts, and then you keep working it down. So are there some people on the periphery who might be a lower risk but have not yet been identified? I can't comment on that yet. But they will be working as swiftly as they can. And the fact, as I said, that you're getting now this increase in positive cases means they have identified the individuals. Those individuals have been tested. They've also been identified as positive, and that's all been happening within the last few days. So that's quite a speed of turnaround. Remember as well that in proportionate terms, compared to any of our neighbours, and even standing in a global category, we test significantly higher than pretty well any other jurisdiction.
Yeah, I was just looking here at the figures, 177,111 so far.
Yeah.
Yeah,
exactly, and that puts it into perspective. Even on mainland Europe and the UK and wider, the proportion we're testing is significantly higher, and
so,
that also influences then the positive cases that you're looking for. We've rolled out, we took proactive steps some weeks ago about enhanced testing within the workforce, and over a period, I think, of 4, 6, and 8 weeks, we're regularly testing, I think it's up to about 40,000 people, if I remember correctly. That's 40% of our population. And that's more than one test, depending where they are. So again, that's about trying to keep that virus suppressed. We're obviously now in the point where enforcement mechanisms are going to back up the mask wearing and the gatherings, and that in itself, again, will take a little while to bed in those further measures that we're taking.
But just we don't want to dwell on this. Enough has been asked about this cluster and how it spread. But I mean, in terms of the how it's been found out, how it's been discovered, has that been through the random testing, or is it because somebody showed some symptoms and they've phoned the helpline?
Well, the short answer on that I don't know, because again, don't forget what we see as the results, if that makes sense. Operationally, you've got to let them get on and do it. I don't know if, Richard, you've got anything at this stage.
I don't know. I'd just like to add, well, I think John has mentioned it, but one of the reasons why we have those numbers now reached 200 is because we are proactively going out to seek people who might have the virus and putting them under the control and the self-isolation. Now that's all our workforce testing and residents in care homes and the like, because we recognise far better to get those people before they know it, perhaps, rather than wait for them to develop symptoms and have spread the virus.
Do we have a breakdown that tells you how many cases of the 200 were found accidentally through the testing programme, and how many have actually been found because people have been symptomatic and called the hotline? I'm just worried. I'm just worried if we're relying too heavily on the fact, we're testing loads of people, that's why we've got more cases. Could it be another reason? No. Could it be that the community's not listening, it's not responding, or we need to increase the measures to prevent it spreading?
The data that we publish does split down between symptomatic and asymptomatic, and it gives the locations, and then it gives quite a lot of other percentages that have evolved over time. The data that we as ministers can obtain, obviously we can get more than that if we need to, and certainly I think from an understanding point of view, we've got to allow the team to get on, and the crucial thing on this is that you act proactively and you get this cluster nailed down. What I think we'll be asking after the weekend is just, are there lessons that we need to be learning from this? We've said quite categorically, I've said it a couple of times over the last 24 hours, it really demonstrates the point about the guidance, what we've been saying ever since March, about keeping a distance, about hand sanitising, and about catching your coughs and sneezes. Those fundamental basics still there. There's a whole range of other things as well, but that's what has brought us to a good position now. I think even in March, maybe April, I did say at some point I was worried about winter, because that was the longer period of time. Yeah. We're now basically into winter, and you're going to see, because we tend to be more indoors at that point, flu season coming through, which is why we've taken the action on getting the flu vaccine out a lot more, of trying to prepare for that as well as we can. But again, that is about behaviour. And again, the issue I think in there is that because we've had a good season, if you like, and we had a good summer, and we're in a good place, I think in certain places people have become a little bit more complacent. In a way, that's a good thing, because it says we've almost been too successful. But on the other side, that complacency, then you need to get away from that. And hopefully, actually, with some of the messaging that's come out in the last 24, 48 hours, that might just spur people into the right place.
So, Constable Norman, I mean, we're talking there about complacency, perhaps is creeping in. You're obviously responsible for want of a better phrase, enforcement of the law, possibly even enforcement of the guidelines at some point if people have to, wear masks and it's finable. Do you think there's enough of a warning out there, enough of a threat, enough of a are people scared enough? Are they frightened enough? Are they just too blasé when they flout? Are they flouting these laws really, or guidelines?
The vast majority of people, and we've seen this over the last 9 months, recognise the risk that's involved with COVID, and the public conscience has reacted extremely well. The vast majority of people have accepted the guidelines, accepted the restrictions that we put on them, because they've been pretty tough, pretty harsh. Reducing people's rights, if you like, to move around freely, to go to venues that they want to go to, and they have reacted extremely well. And so the conscience of people and peer pressure, I think, is helped tremendously. When you think back, I mean, John mentioned just now, thinking back to February, March, we were looking at the possibility of 500 plus deaths this year. We were looking at something like 40% of the population having COVID, and this was scary. This was scary stuff when we were talking about it around the Council of Ministers table, and so we reacted. The Council of Ministers reacted to try and make sure that the health service was not overwhelmed, and by Jove, haven't they done well? Now you mentioned just now that 200 is a landmark figure. Yes, it certainly is. But people mustn't be frightened about this, because 2 people today are in hospital. We've got 140 a bed Nightingale Hospital out there to support the island, to support the population if things get worse. And please God they won't, because we're so close to getting control of this virus. We know that they're going to start, hopefully, if everything goes well, start vaccinating in the middle to late next month. So what I would appeal to Irelanders is to keep confidence, keep vigilant, and then we'll get through this. I think the poster says we'll get through this together. We've done it so far. Don't lose faith now. Let's keep vigilant, and we will get through this.
So, I mean, in a sense, Health Minister, it's quite fortunate that we're on the brink of getting the vaccine. We're suddenly seeing this spread. Thankfully, it's not going to be too far away. I know it's difficult to put a date on it, but we're hoping, for those that may not have seen the press conference earlier or seen the news this evening, you're hoping that we may be able to start rolling it out as soon as next month.
We are hoping for some small amounts of the vaccine to arrive before the end of the year, and we have a list of priorities, and the first doses will be available to residents of residential and nursing homes, and we have a team ready to do that as soon as it arrives in Jersey.
Now, I saw the breakdown as you will move through as more vaccines arrive, then different areas of the community will receive the vaccine. At the moment, under 18s children aren't going to receive it. Is there any plan in the future to try and get a children's vaccine? Have you heard anything?
Yes, there is. I think the reason for that is that the trials that have been conducted throughout the world have not involved children as yet. And we know that children are perhaps at least risk of serious illness from COVID. So obviously the priority should be the most vulnerable first of all, and coming down through the age groups. By the time we have done all that, both in Jersey, the UK, around the world, there will be more knowledge of the vaccine. They will have carried out some investigations of how it might affect children, and a decision will be made at that later stage whether to vaccinate children.
Just on the subject of children and youngsters, obviously students, university students, will be moving between Jersey and the UK. whether it's Christmas or
Yes.
Easter or whatever. Where are they going to fall in the vaccination programme? Who's going to be responsible for them? Have we worked that out yet?
That is a good question. I mean, they are regarded as Jersey residents temporarily in the UK. It seems to me that we would vaccinate them, but then, of course, if they're... depends where they are at the time, doesn't it?
Yeah.
And it depends on the UK's programme, how they might vaccinate their own students. Would they require the vaccination to take place in their home areas or in the universities?
Yeah.
But I don't think the planning is at that age group yet. There's a plan to vaccinate everybody to age 50 and above, and then the next planning stage would involve people of
Gives some
lesser
time
age.
to work it out. Fine. I mean, Chief Minister, something you said in the press conference earlier as well that struck me was that Jersey and all the Crown dependencies are being provided with these vaccinations for free.
Yeah.
I mean, how come that's come about?
Well, it's fantastic, but it also demonstrates the relationship we do have with the United Kingdom. We are.
Were you expecting to pay for them?
Well, actually, I think we've had verbal confirmation for quite some time, certainly over the last 4, 5, 6 weeks, I would say, that it was likely to be free. But obviously, until we've learnt on this, you want it not just generally, that events change so much that until you've got it confirmed in writing. And that's not a criticism in any shape or form, by the way. We're delighted, but you don't put that out there until we've actually had the confirmation. So no, we're delighted with it. I mean, it is a mark of all the way through, actually. So I'm trying to think when my last meeting was. I think it was yesterday. We've been having either a weekly or a two-weekly call with the Ministry of Justice. That's for myself, with Ian Gorst usually, and then with the Chief Ministers of both Isle of Man and Guernsey. And a lot of that, some of it's been around Brexit, but some of it's around COVID preparations and any issues we have. And, there's been a lot of support and a very good relationship there, which has been built up over a huge number of years. And it's about us being part of that sort of wider British family, but also respecting, because we are in a constitutionally different position, which again has been very useful, because actually for the fact that a lot more departments now, particularly as a result of Brexit, understand that. If I could just want to add one other point now, when we're talking about the vaccine, the crucial thing to guard against now is complacency, as Richard and others have said, and as we said today. In fact, I think Ivan said it at the press conference. It's small doses that are coming through. The likely timescale on this is probably to get to the level of vaccination that we're trying to achieve is probably March, April. Okay. And so actually we can't relax from the measures that we've been talking about just because a very small 1,000 of people have been vaccinated before Christmas, potentially.
That was going to be my next question. When do you envisage the restrictions to start to perhaps ease off slightly, or are these with us now forevermore? Because we've got, I think, is it on the Pfizer vaccination, 94% so far, the Oxford one, 93% success rate. So there's potential for a small proportion of the community to be walking around thinking perhaps they're safe when they might not be. Also, I don't know how long it's going to take for the UK to roll out their vaccination programme. So how long are we going to keep testing people at the borders? Could people still be coming over when they may not have finished in the UK? Is there a long-term strategy for how we're going to come out of COVID?
So I think the initial focus is to get us through to, let's say, to Easter, to March, April time. I think after that, we are going to be planning for that, and we have kept money in the budget for testing. I think it's for the first 6 months from memory for next year. That's the border testing.
And then passengers will pay for it themselves if it's continuing.
I think what we've said on that is you don't want to be necessarily first mover there, because you've got to see again, you're then moving out of what I'll call the health crisis into the economic impact, shall we say. Again, you can have every doom and gloom scenario you can think of, 2008, 2009 financial crisis, all that type of scenarios, or worse. Equally, other people are suggesting, depending on the impact, that some sectors have not been affected as much as people originally predicted. So it's too early to say where we are. But you've got to because you might be in a fragile economic position, the question will be is how much do you charge? Do you charge it, and at what point? And there's some debate about testing on departure and charging at that point, because you don't want to suddenly wreck the prospects of, for example, for tourists coming here, say. So those are those sort of measures, and that position changes quite often. So you'll kind of evaluate. We'll be looking at that in about March time and get that process in play. We are doing some preparation as well, which certainly I've asked for, which is other measures, i.e. how we get through January, February, March, and actually what do you do, hopefully by then, as we start coming out of it, and what do you start planning for?
I mean, as was alluded to in the press conference by a couple of journalists today, there's already rumours and questions being asked about the vaccines and worries as well from people. And I've even seen comments, people saying, oh, actually, I'm going to choose which one I want. I don't want the Pfizer one, I want the Oxford one. Are people going to be able to do that?
No, they're not going to be able to do that, I'm afraid. But Dr. Muscat was telling us today that apart from clean water, vaccines are the single most effective preventer of disease in the world. They are safe. It's proved by so many tests, and these are also safe, as far as anyone can ever say. And they will be submitted to the regulator. They are with the regulator now, who's conducting the final tests to give approval. And we can see that the authorities around the world, the people in the know who should know these things, virologists, immunologists, and the like, they are confident that this is the right way to tackle COVID.
Okay, well, look, thank you for that. Look, just a reminder to everybody watching, if you want to get in touch and ask a question, I can see them coming in. We're going to move on to them now. Just quickly hop over to Slido. That's Slido, slido.com. Once you're there, enter the code GovPlan2021, and then you'll be able to post your question and we'll start. So there you can see it on the screen now, bottom left-hand corner, GovPlan2021, and your questions will come in. You don't need to log on, you don't need to give your personal details, you don't even need to put your name on the question if you don't want to. So just looking at some of these questions coming in, Chief Minister, I suppose, first of all, this will be one from you, and this is coming from Amir, and this is a question no doubt on a lot of people's minds at the moment. Do we have a time frame on an announcement for Christmas? When will people know whether they're buying a turkey for 2 or a turkey for 10?
Where we were at the beginning of the week was obviously rates were stabilising / looking like they were coming down. And that might have allowed us to assess things for a couple of weeks, see where we were, and then put some further announcements out. I think what the last 2 days have demonstrated is that there's a degree of unpredictability. In other words, what's the expression about events? But anyway, events coming through that sometimes change your direction of travel. And so at this stage, it's, again, unfortunately, too early to say. I think the other concern within all of that lot, what appears to have been, what we've seen, both at half-term, both at Guy Fawkes, potentially as a result of this event in the last few days, is that it demonstrates the issue around gatherings. And I think basically we'll have to put some guidance out, but it's probably too early to say if it's going to be any different to where we are now, which is the limits on gatherings that are... Just
see where these figures go in the next few weeks.
And assessing accordingly. What you do not want to do is we wouldn't intend this in any shape or form anyway, but have a free-for-all for kind of 2 or 3 days in Christmas and effectively be regretting that all the way through January. And I think that's the crucial thing. I suspect Christmas is going to be a family time or a small group time, and that's what we've got to go through. But that is a personal gut feel rather than a definitive statement on policy at this stage.
Okay.
I think, could I just add, the current guidance is that there should be no more than 10 people gathering indoors. But that doesn't mean to say that 10 is safe and 11 isn't safe. I think I'd urge them to understand that any gathering could be a risk. So they don't have to try and cram in 10 people. I hope people will think if they've got somebody vulnerable in their family or elderly, don't hype up the risks, just think carefully. I think we've all got to do Christmas a little differently this year, just for this year, and maybe have a quieter Christmas for some, and that can still be very enjoyable. But just think about the risks, because one can gather together, try and do everything right, but it is possible that COVID could spread as a result.
Is there a way using, not everybody, please note this, but for many people, technology has taken a somewhat greater presence in their lives, even if it wasn't there previously. So, will families, for the sake of argument, actually, rather than having certain people there physically, almost have them on the TV screen at the bottom with a camera? I mean, that's not the
Stick
same.
a TV on the dinner table.
Well, it's
I know some families are doing that now.
it's it's a difficult one, but at least then, although they're not in the room, they are part of it, and it's how you manage that. And I think the other plea I think for all families is to make sure they do, telephone, Skype, whatever it is, their relatives and things like that, and I'm sure they will.
Yeah.
But make sure that we don't overlook the people who might be feeling lonely this Christmas or into January.
Yeah, I
Constable
think
Norman?
it's important, that people understand the last thing any of us ministers want to do is to reduce people's liberties, but also what we want to do is to keep people safe. This virus, no virus, is a respecter of seasons, unfortunately. And when you look at the cases we've got now, as John said, they've been caused probably by parties, gatherings, and so on. But so far, in the main, it's been kept away from the most vulnerable, who are those with underlying health conditions, and the elderly. The problem with Christmas, one of the things that happens at Christmas is you do tend to meet with your families, the older members of your family, those who haven't been well, and those are the ones who are most likely to suffer if COVID is transferred to them from someone who has got it but is relatively healthy and is going to get over it. And this is what I hope people in Jersey, and I'm sure they will, understand that they're really, as you used the word before, vigilant, and I hope they will understand that.
I mean, you mentioned liberties there. Health Minister, there's a couple of questions I can see here coming in. People kind of waiting, when are you going to make the mask wearing mandatory? I mean, I think everybody's anticipating perhaps an announcement on Monday, or an announcement before that to tell us on Monday everybody now needs to start wearing masks. Is there anything you can share with us this evening?
Yes, my officers have been drafting very hard. I've seen this afternoon a draft order that I will need to make, and that will probably be ready on Monday, and the likelihood is that it could come into force the next day, that is Tuesday.
And what's that going to make us do? Where are we going to have to wear masks?
As I explained in the States Assembly, it'll be in retail premises, shops, supermarkets, pharmacies, banks. It'll be in healthcare settings, so that doesn't just mean the hospital, it means your GP surgery, the chiropractors, physiotherapists, that sort of thing. Let me think, it's been a long day.
Well, what about are there any plans to increase the number of school children that need to wear masks?
Well, schools are governed by a separate guidance. I think at the moment it's the final 3 years of school that are being asked to wear a mask, because they're of an age where it does seem that they can catch COVID and they can spread it easily. So the schools are sort of within a separate regime, and but I don't think there's any plan to extend beyond the current years.
And Constable Norman, I mean, we've seen things. Is it £1,000 if people don't wear a mask potentially? How do the police feel about enforcing that? Have you spoken to the police chief?
Well, yes, of course I have.
Yep.
I speak to him on a regular basis, as you would expect. But the police's attitude, quite rightly, and this is the States Police and the Honorary Police, is they don't want to be policing people. They want to be policing the virus. Now, I was in town earlier today, and I've seen a sea change over the last week or so of the number of people actually wearing the masks, even though it's still voluntary. And the police will be there to support the retailers and the other organisations, but they will continue with the way they've policed over the last 9 months. Actually, if you think about the 4E's approach, which is engage, explain, encourage, and then, if you can't get anywhere, you enforce. But we're looking to cooperate and work with the retailers, to support the retailers and to support the public. It's not about going around looking for someone not wearing a mask.
I mean, and Chief Minister, are you happy that, you know, shopkeepers aren't being put into an awkward position by trying to suddenly become doormen or bouncers and having to refuse entry and get into arguments and rows or Constable?
But they've been doing that. The shopkeepers, the retailers, have responded so well to the requirements and the requests of the Council of Ministers and the health professionals. You know, you go back to the time when it was 2 metre physical distancing. The retailers had to police the number of folk actually going to their shops and making sure when they were in their shops they were 2 metres apart, and they did it amazingly well. They respond. You know, they are responsible people. The retailers in this island, they did extremely well then, and I've got no doubt at all that they will respond very positively to any orders that my friend the Health Minister makes.
I think the point is, don't forget, as a community, it's in all of our interests to try and help on this.
Yeah.
So, so if one sector says, "Oh, it's not our responsibility, it's not our problem," well, what we're trying to do here is avoid a lockdown, which then, you know, so if as a consequence of actions here that affects all this part of the community, please, you know, that's what we've got to do.
Is there a figure that if we reach it, we might have to go into a lockdown?
We're always doing it on the basis of the medical and professional advice. It's always about balance of risk. You've got to remember that, and it's a combination of working out where what's called the positivity, i.e. the sort of rate of overall underlying infection. It's about speed, and it's also about where we think we are with the clusters, and you know, if those numbers were to continue to going up, but actually the underlying serious levels of infections are remaining low, so for example in a hospital, then that's one area of risk. You know, we're saying actually on balance we're still into the lives and livelihoods equation, and actually we still stay where we are. You might bring additional measures in, for example, but equally, as Len has said, the Nightingale was there as an insurance policy. In the ideal world, you don't want to call on that insurance policy, but if we needed to, we've got it there.
Well, you know, talking of insurance policies, obviously the mask wearing provision that was granted to you last week, Health Minister provided the states, or those powers that were given to you. This week. Yeah, sorry, this week. Yeah, I mean, though, could that insurance policy have not been cashed in maybe earlier in the summer, so we were ready for this? If that mandatory mask wearing could have been introduced a bit earlier, we might not be at the figure of 200 now.
It's conjecture. It's possible, but you know, we've been asking people to wear masks. It's been strongly recommended. There's been a gradual uptake. I'm confident that now it is law, or will be law shortly. People will accept that, and we'll see an overwhelming acceptance of it. You can never sort of recalculate and say, well, if it had been a week or fortnight earlier, it came when it was ready. These things take time. It's an unusual piece of legislation. We're not used to legislating in this way to take away people's civil liberties, especially around other gatherings legislation, for example.
All right, Constable Norman, at the moment, people arrive into the island and they're tested. One of your area of responsibilities are the borders. A question's just come in here from Phil Johnson. Will the port access change next year so that maybe we include a requirement that people have to have had the vaccination before they come? So we'll only accept visitors, tourists who have been vaccinated in their own country.
Yeah, that's not a discussion that we have had yet. But of course, it depends on when they have the test before they depart wherever they might be coming from, the veracity of that test and that certification. I think people around the world, well, certainly around Europe, have looked at the regime that we put in place going back to July, I think it was, July, and they are so envious of what we did, but not only what we did, but how we do it. By doing the testing ourselves, it gives us absolute confidence in the testing regime. And as John said earlier, when you look, I think we're probably about third or fourth highest in Europe for the number of tests we've actually carried out. You can go into any place in Europe now without a test. Anyone at all. You can go to fly to the United Kingdom tomorrow and go wherever you like without a test. You can't do that in Jersey.
Well, somebody just asked here as well. I mean, has it been worth spending all those millions to maintain and provide a liberal open border policy? Has it been worth it?
When you look at the numbers that we've got over the last 9 months and the position we were likely to be in if we'd done nothing, no question, it's been well worth it.
Okay. Right, we will invite Keith. Are you sure? No problem at all. Okay. Right, well, we'll stick with the questions here. As you can see, the questions are coming in thick and fast. If you want to ask one, go over to Slido, S-L-I-D-O, slido.com. Post your question in there anonymously using the code GovPlan2021. So let's get back to some of these here. So, Chief Minister, perhaps, why is it that flights are coming in from red zones? And are people being tested on arrival followed by further testing? Well, let's stick with the first part of that question. Should we maybe turn flights away that are coming in from red zones?
No, I think we took the decision quite some time ago around the border testing regime that essentially we welcome people coming in, but obviously we apply the testing regime that we do according to where they've come from. And provided that continues, it's, I think, been demonstrated it works very, very well. And it's about, as we said, managing that risk. And don't forget, some of those people, particularly now, many of those people coming in could be locals returning, could be family members of local residents, will include students. At what point do you draw that line? And it could be people also, which is we've always had the Lifeline service, but doing routine medical things, so routine medical visits to the UK, for example. So the whole point is to accept people coming in, but making sure if it's a red zone, it's a test at day 0, it's a test at day 5, and it's a test at day 10, and they can't move until on that test at day 10. That all of them have been negative. Well,
you mentioned students there. We've got a question that's coming from the Student Loan Support Group, and they're saying, why is it taking the Council of Ministers months to sort out the student travel, self-isolation, and those sort of things? They need to get flights booked. There's lots of talks about flights being booked, but there's no action. And then that's followed also by Sharon, who said that she needs to know about flights. She can't get her son back from uni at the moment. She's got him booked. He or she booked on a flight back on the 22nd of December. There's been talk about extra flights, but there hasn't been any put on.
There was a press release that was sent out today, which identifies the support. I actually signed off the business case. In fact, I actually signed the MD today, but the business case was signed off a few days ago, to give the extra support to Blue Islands. And as I've understood it, which I'm actually just looking down the details in front of me, that Education, I think, have now closed the survey, but they were doing a survey from students, which was to identify, A, who was likely to be coming back, and then just assessing roughly what parts of the UK they were coming back from, and where flights might be required. And certainly on the back of the press release that I've got, does identify the flights in the UK travel window as it's identified between the 3rd of December and the 11th of December, and it's broken down between flight and location. So Bristol, Liverpool, Gatwick, Heathrow and Southampton, for example, and the level of flights that are there. Those are the commercial ones. Obviously what then happens is if there's still gaps in that system, that's why the Blue Islands, as it were, I call it the Lifeline flights, but we've said quite clearly that if there is a cohort of students that aren't being catered for, that's where the Blue Islands flight will kick in. So I think really the answer there is go back to either helplines or in extremis to education themselves to get the information through. But they are working on it, and there has been a plan that's been put together.
And just to be clear, I mean, if those commercial flights don't operate or aren't operating, and the island has to think about getting a lifeline flight into, for example, Birmingham to get a cohort of students from there, those students, they still have to pay for that lifeline flight. It's not worth gambling and thinking I'm going to get a free ride home.
No. So no, I mean the point is that if people were coming back at Christmas, they were all no doubt expecting to pay for a flight to come back at Christmas. What will make sure that there is a flight, but they will still have to pay for it in some shape or form. And I think the other point I would say is, if you use Birmingham as the example, it will depend. So if, for the sake of argument, we've got 80 students up there, then obviously you'll arrange something direct, I would imagine. If it was actually 5, then I suspect it might be we'll get the train down to Gatwick or Heathrow, and we'll sort something out there. But so it's going to be that we've got to be flexible around this. There is this is dealing with, again, extraordinary circumstances and quite large volumes of people who need to travel. But as I said, education are on the case. They have been working together, and I know both Deputy Senator Val and Deputy Masson have been working quite closely on this to get it in play. And as I said, the latest press release will be on the website, and that was put out today.
So if parents want some of that information, they can go to gov.je, go to the news releases, and they'll find it there.
Yeah, they'll find something there. And as I said, but if not, always they can email through to the relevant helpline inquiries, or they can dial through as well.
Okay.
There's a lot of work been done on this in fairness, and the indications are at the moment that there's plenty of capacity for these students to come back on existing commercial flights. British Airways are coming back at the end of next week, I believe so. EasyJet are still flying, Blue Islands are flying. That there is capacity for students to get back. I think one of the things that's worrying students more, or some students more than actually getting a flight, because most of them probably booked already, is the self-isolation when they get back. And education too are helping in that area for those who really won't have the facility to self-isolate. So there's a tremendous amount of work going on, and as John said, there's the backup of emergency flights if the commercial flights fail.
So as we've done previously in this, we've been dealing with this over the last 3-4 weeks. So if a student's coming back to family where the student got to self-isolate, but for whatever reason the family can't cope with that, perhaps the family are working in the care system or something along those lines, a healthcare system, then there is provision that we've got some accommodation ready that student can go into, just to maintain that basically to get through that quarantine period. But and there will be measures in place to support that student.
In fact, so I mean, the advice at the minute then is get online, book a flight, and then if for some reason that flight doesn't go, the government will get them home somehow.
Yeah, exactly. Yeah. But make sure that if you haven't been directly in contact with education, do so.
Fine. Okay. So, Health Minister, bringing it back round to you. There's Dr. Ivan Muscat said something in today's press conference about the vaccination programme, which struck me. He said it's a gift, don't throw it away. Yes. Which was a fabulous quote in my point of view. But what happens, we've got a question here from Martin, what happens if someone doesn't want the vaccination? Are they going to be forced to have it?
No, absolutely not. We don't want to do that. It's not mandatory. But it is highly advisable because all of the best public health officers and our medics say that this is safe and effective. I certainly believe that. I want to have the vaccine, and I hope all others will take up that gift that we are offered. It's not just for us, it will protect our families, those we live with, our friends as well. So let's do it.
And we've had a couple of questions in here as well from Anonymous and Anonymous. The people are wondering, are teachers included in frontline staff?
Yes.
Okay.
But
I
see what you mean in the case of the vaccine.
In case of the vaccine being rolled out, I know there is frontline staff who worked in health and social services. Then there are other frontline. Or other health and social workers.
Let me correct that. So for the rollout of the vaccine, the only staff group that would be part of the priority list would be those working in healthcare. That's not just hospital, but it's nursing homes and it's all healthcare venues because that's close contact. So teachers would not be set aside as a special group to receive the vaccine. They would receive it as part of their age group.
So that means if you are a teacher under 50, you might not be getting it till Easter.
That's possibly true. Yes, though under 50s, that it hasn't reached that planning stage as yet, that detailed planning. But in the same way that,
do you think that might need a rethink? These people are in front of, groups of children, sometimes 30 plus every day.
Yes. So I mean, I'm sure there are many groups that could make a case to be prioritised over some other group. This has been thought through very carefully by the UK authorities. We are following the very careful planning that has taken place in the UK. Dr. Muscat has been part of that with the medical officers of health and other officials in the 4 nations of the UK and the other Crown dependencies. I will have trusted them to have assessed the priorities and worked out how best to deliver this vaccine. I believe they've got it right.
I mean, this might be a bit unfair because I know we've only just announced it today, but I mean, when you are vaccinated, do you get some sort of pass, some sort of identification, some sort of ticket to say, well, I don't need to wear a mask anymore, I can go and get on any plane I want, I've had the vaccination, I'm safe?
No, it's not a get out of jail free card.
Right.
So no, there's no...
There isn't
that government certificate. We can't do that.
Was there any plan to maybe relax the restrictions for those who've had the vaccination?
No.
Okay. Same applies.
Same applies because we need to keep our communities safe. You must think if you may be carrying COVID, if you may be asymptomatic on the day you go, you can still get the vaccination, but it's already within you. You may be spreading it that day or the next still. So these things will take a time. The vaccination program will take a time before we see its effect.
Okay. A couple of people here have asked Chief Minister about should we be reporting cases at the weekend so the public can keep informed? Because I know there's always a bit of a lag between the Friday and the Monday for when we update the cases.
Oh, you mean in terms of just the data output?
Yes.
I think to date it's actually just been purely logistics. The teams are there and the testing is taking place and all the rest of it is purely the individuals and there's it's a very small number of the team who then compile that data. I don't think at this stage we need, when I say we need to, obviously it does create you'll see a cumulative jump on the Monday because it's Friday, Saturday, Sunday, or Saturday, Sunday it's coming through. But there is, every time you do that, it's landing on somebody, and in all of these, we're quite small teams that we're dealing with, who then, has to do work yet another day in terms of bringing the data together. So I think the system to date is working well, and the reporting is going well. I don't think we need to. We'll also keep an eye on that as we're going forward, mind you.
Okay. And what about another thing is working from home? Some people are asking here as well. Are people still being encouraged to work from home if they can? Or is that something that might come in?
At this stage, I think it's down to the employer, essentially. I know certainly within in the building we all work in, we are switching back to what we call an A and B team. So one team's in on one day and the next team's in on the next day. And that's precautionary, particularly in government, because of the impact if you took out the entire team in one go. And it's very much down to, I think, the individual employers at this stage as what they want to do. There's certainly, conversely, there's certainly no discouragement from working at home. But we are trying, this is the whole point, we are trying to keep people into as normal an existence as we can during this crisis. Now, if things develop, depending where it goes, going back to highly recommending home working is within the armoury that we've got. To date, we prefer not to do that, and if we can keep it managed as to where we are, deal with the clusters and keep going, then that's the position we want to try and stay in.
Just talking about working from home and the working environment, somebody's made the point here that some offices have more employees in than some shops might have customers. Should people in offices be required to wear masks as well, especially if you're in a very large open plan office?
Well, of course, if an employee wishes to wear a mask, they're free to. I'm sure they wouldn't be prevented from wearing a mask. Every employer is required to provide a safe place of work, and there are specific guidelines around workplaces and office premises. In an office, generally, you can achieve physical distancing. You can have hand sanitizer at appropriate places. So it's different from a shop where you can't control who's in the premises and around you. In an office, you can, and that's why the guidance is different for offices.
And also your tracing side, you will tend to sit near the same group of people day in, day out. Whereas if you go into a supermarket, you will come into contact with a completely different range of people every time you go in. So your risk profile is slightly different.
Yeah. Right. Well, I know we're jumping around a bit here on the different subjects, but we're just going to follow the flow from the questions that are coming in from the people tuning in. Health Minister, I know you're not a doctor, but what symptoms? Somebody's asked here, what symptoms? Can anybody expect to actually have any symptoms after they've had the vaccination? Should vulnerable groups who have been shielding all these months be concerned that they might have some sort of reaction to it?
So I remember when I went for my flu vaccine, the nurse very helpfully explained to me what symptoms might occur after that vaccination. You may have some mild symptoms of flu, or feel you have a headache or something like that. And she said that's perfectly normal, and I was handed a leaflet to explain that. And I imagine, I'm certain that that would be explained to people attending. I don't know actually what symptoms might arise. They're not really symptoms, they're side effects, aren't they? Side effects, let's call them. But we know that in many things there are side effects. These will be mild because there has been lots of testing on possible side effects as these vaccines have gone through their trials, and they are deemed appropriate vaccines and safe vaccines. So I wouldn't want people to worry about side effects, but all that will be explained at the time of delivery and will be available beforehand.
Right. And I mean, again, people are. What's the best source of information for people who are worried about the vaccine? If they're seeing things on social media, wild, tabloid newspaper reports or whatever it might be, who should they trust?
Well, I would go to information provided by Public Health England, and they will have all the research there, or links to the research about the vaccines that the UK government are ordering and which we are sharing in that supply.
So, sticking with that, somebody anonymous here has asked that Pfizer have said that the vaccine doesn't prevent catching COVID, but reduces the symptoms to that of a cold. Is that true?
I've not heard that.
Okay.
That's a question Dr. Muscat would have to answer, I'm afraid.
No problem. Well, and also one for you, Chief Minister, but we don't want to get too bogged down into the finances of it. But have the states conducted a cost-benefit analysis for their COVID response, given that it has over here a 99.97% survival rate? Has all of this money we've spent been worth it?
Well, I think the answer to the last part is exactly what Len was saying, is yes. And you've then got to look and say every jurisdiction that I can think of has spent a huge amount of funding on this to protect people. And I think the other point which Dr. Muscat has made on several occasions, I think publicly, but certainly to ourselves as well, it's not just about survivability. I think they're now calling it long COVID or something. In other words, the underlying conditions that can sometimes come through, and that can be at all age ranges. And you do come across some people say, well, it's, fine from my age range, it's just the elderly. Well, the definition of elderly in this ranges. I think even now the fact that the vaccination will go down to somewhere between 50 and 60 gives an indication of the age range that people are concerned where it does have an impact. And looking around the room about casting aspersions, I suspect that covers at least 50% of everybody in this room. But anyway, but it also means it's your parents or it's your grandparents or whatever it is. And then you get some other symptoms. I'm fully aware of people much younger who have underlying health conditions. It's about protecting them. And actually some people who weren't aware they had underlying conditions, and that can have an impact on them as well. And I think, therefore, and as Len said, and as I said on a number of occasions, Friday the 13th of March was the day I remember, was when Ivan came through with the updated modelling at that point that said, if we don't do anything, 500 people could die, excess deaths. And I think that does somewhat bring it home, because if that had happened, I suspect the backlash from the other side would have been quite considerable as well. And that's where one of the difficulties we have in terms of forecasting the spend is obviously, well, there's what we've budgeted. We'll only know at the end of the year exactly how that matches the reality. We hope we've budgeted, when I say conservatively, i.e. overestimated what we seek to spend. We'll know at the end of the year whether we have overestimated or not, and what those numbers look like. I go back to the point, and then I'll stop, you'll be delighted to know, which is that because of the circumstances we faced, and the circumstances that, particularly to Jersey, I'm talking about our tax structures, and what the states approved 3 or 4 weeks ago now, which is, we abbreviate to the PYB, CYB, it's the prior year basis versus the current year basis, that has given us a strategy for clearing the COVID debt, which, although it has a cash flow impact, means there's no permanent tax increases built into the system to clear COVID. So from that perspective, I think, again, we've hopefully done our normal process in Jersey and have developed something that supports the island going forward for the long term.
Now, I know you've said it before, but what do you say to those people who are shifting from the prior year tax to the current year tax, who maybe feel it's not fair that I've got to pay for this? Why doesn't everybody else? Well,
the attraction of the move from prior years, and depends on age ranges here. Some people never appreciated that. I'll use the old retirement age of 65. That when you retire at 65, the following year, probably when you've got less income, you were still facing a full year of tax, tax bill, full year of tax based on when you were working. And what this does is essentially allows that to be spread over a period of time. It was also, and that particularly came into focus this year, and I'll suggest self-employed people will be across different sectors of people in the economy. People who've taken a hit in their income this year would ordinarily have been expected to pay their tax, broadly speaking now, based on their 2019 income. And so from memory, the benefit of what we've done acts as another part of the fiscal stimulus package we've done of about 18 million. And that means that gives, I don't know how they've calculated it, but it gives an indication that there's quite a number of people who will be assisted as a result of this. And again, that's about mental health, actually. You don't have that stress. Hopefully that's health matters. And again, physical, it's that financial position. So we've shifted that liability away. Obviously, people will still have to pay tax, but it's based on their 2020 liability. And there's this issue around generations and all the rest of it. Actually, we've all come through the pandemic. What this does, it doesn't burden any one generation with a permanent increase in tax. My tax profile as an individual, my tax bill over my lifetime won't have changed. I'm being asked to bring it forward and to spread it actually over 20 years at the moment. So, and that's certainly, speaking personally, something I think is perfectly reasonable.
Health Minister, I know you touched on this during your press conference, but we've got a couple of questions coming in about it, so perhaps some people might benefit from hearing again. What about vaccinating those in our community who may be pregnant? Somebody's asked, will pregnant women be amongst the first to receive the vaccine?
No. Dr. Muscat did speak about that today. Like all vaccines, I believe, the advice is to wait until the end of the pregnancy before receiving the vaccine. And if a lady has received the vaccine before knowing she's pregnant, that's not a concern. But it's advisable not to have the second dose. I don't believe that's because there's any risk to the fetus. But that is the medical advice.
Okay. And that's presumably they can speak to their GP about that
yes,
as well.
Yes.
Because I'm sure it'd be a very worrying time for pregnant women. Obviously with vaccinations coming in, not knowing how that might affect the baby. And
of course. So, this is all brand new to us, or this news about a vaccine, this good news. So there'll be so much more detail coming out in the following weeks. So that will be crystal clear. There'll be clear guidance to all sorts of groups, people who are pregnant and vulnerable people, exactly how they should address their needs.
Right. Somebody's also asked here about going back to masks again. Would it be easier just to make everybody wear a mask whenever they leave the home? So they're wearing them walking down the street, they're wearing them in the car, because we've already got to wear them on the bus, if we're going to wear them in the shops, rather than take it on, take it off, take it on, go into, What do you think about that?
If somebody wishes to do that, they can do that. But the law quite rightly says that we must only make masks mandatory where it is necessary and a proportionate response to protect people from COVID. And outdoors, the virus would disseminate very quickly in the breeze. There's not that degree of risk that makes it necessary to make it mandatory outdoors. But, it certainly does no harm if people wish to keep themselves safe that way or keep other people safe. They're free to do so, but not in a mandatory way.
Right, well, you're listening to the Health Minister, the Chief Minister and the Home Affairs Minister here at the 5th Government Plan virtual debate. This is your chance to ask your questions directly to our politicians. You may have watched the various press conferences throughout the summer, be them in Jersey or even watching Boris in the UK, and been screaming at the television with your question. Well, this is your chance now to get involved and get your question put to them. As I've said a few times now this evening, just hop over to a website called Slido, slido.com. It's on the screen now. Enter that hashtag at the bottom, GovPlan 2021, and ask your question. You don't need to give your name, enter any personal details, and or log on or download anything. So it's really, really easy. So just changing tack slightly here, Constable Norman, you're obviously responsible for, amongst many things, the emergency services. Has the draw on public finances had an impact on those departments, either in the immediate term or even in the long term, for any plans or ambitions that they might have had? I know we're looking possibly for a new home for the fire service at some point.
Yeah, no. I mean, certain projects have been delayed, like they have in all departments. But the service offered by the emergency services has not deteriorated one iota. In fact, I made a statement in the States, I think it was back in September, praising all of the emergency services and the support services, because they have done a terrific job keeping the island safe during this very difficult time. And they've been very proactive in how they did that. I think of the fire service splitting themselves between Rouge Bouillon and the Western Fire Station. The ambulance service, who had a very torrid time at the beginning where people were phoning the helpline, didn't like the advice they got, so then rang 999 and sent for an ambulance. But that soon calmed down. But they had tremendous cooperation from Normandy Rescue and St John's Ambulance. So they too split their resources. Excuse me. The prison service too. Excuse me. The prison service too. Sorry.
Right.
Can I
Get
come?
you a glass of water.
Can I come back? And
Of
chew
course
up
you can,
on-
of course.
On that.
Somebody test him, please.
Yes.
That's why I'm sitting down this one.
And when you saw the cooperation, which beyond we'd ever seen before between the States Police and the Honorary Police, particularly when we were people were only supposed to go out for an hour or two a day at that time, doing the police checks, working together, but working for the people, not against the people, and supporting them. I mentioned the prison service until we had an officer who contracted COVID last week, I think it was. We didn't contract it in the prison. The prison has been kept safe by a lot of good work by the prison management and the prison staff. So I just think they've been absolutely superb. And you can think of Customs and Immigration as well, who took control of the emergency flights, allocating those, keeping the border safe by checking people coming in at where they shouldn't be coming in, and even monitoring the offshore reefs. So no, your question was, have any resources been lost from them? No, they haven't, and they won't be. So a few projects have been deferred, but nothing has been cancelled.
Any major projects? Anything significant that they've been banking on for a while?
Yeah, well, a lot of investments gone into customs and immigration this year because of Brexit at the end of next month. So, but they're already now in their IT systems are already up and working. We're probably most ready of all the jurisdictions, and I say that with great confidence. It might come back and bite me, but I very much doubt it. So. The investment, things like an aerial ladder for the fire service has been delayed for 12 months. But that could have, because you can't get the thing made because of COVID, where the factory's closed down for a while. This sort of thing.
But we still have one in operation.
Of course we do. Yeah. And the combined control room. We are investing a lot of money in there to get the IT systems talking to each other, because in the past the fire service, the ambulance, and the police have all had different IT systems. We want them on one so they can all communicate easily together. That's been delayed a few months, but that will all happen.
And Health Minister, how about yourself? Any ambitious plans for the Health Department which have been impacted because of COVID?
What was impacted because of COVID was normal hospital and healthcare, and that has been a worry. So I'm very pleased to say that with our surgical waiting lists, we're back at the levels that we were pre-COVID, and we're one of the few, if not the only jurisdiction to have achieved that. So our staff in the hospital have done a great deal of work to bring people in for their operations over the summer, and we're back on a good position there. But of course we want to continue that. That is why it's so important that people observe the guidelines, that we stay at a good position, and we're not bringing people with COVID symptoms into the hospital and having to care for them, which would mean that all the surgical work we need to do is delayed. Perhaps the greater worry is our outpatient appointments, because all that ceased during the first wave of COVID, and they usually come from GP visits. People go visit their GP and are referred on to outpatients, but that wasn't happening. People were locked down. And since the GP surgeries have begun again, then naturally we've seen that pent-up demand come through, which is good, but it has increased our outpatient waiting lists, and we want to deal with that as quickly as we can. We're trying to get through that. But we are worried about what might be unseen, that there may still be people who, because they feel they have to shield, because they're worried about going to their GP or into the hospital, they haven't dealt with that problem that they know they should go and see a doctor about. And we want to encourage them to do so. It's safe to go into your GP surgery, it's safe to come into hospital, and we don't want those problems building up to something that might turn out to be worse in the future than if we treated it now.
I mean, one of the things that might have, that certainly did help people go to the doctors during the lockdown was the deal that you struck with GPs to make it far more affordable for islanders to visit their doctors.
Oh, yes.
Is that something that may come back?
Where we are addressing the question of
it's
affordability.
It's suddenly gone from,
Yeah.
what was it, £20 or £10?
It was £20.
And now some GP says you're charging £50 plus to see a GP. And that's going to put people off going.
Yes. And it does some people. We know that, we recognise that. And in this year's government plan, we said that we were going to address that problem and assist those who are financially vulnerable. And that is being worked on right at the moment, and we expect before Christmas to be able to announce something. There's been extensive negotiations with GPs and the Social Security Minister, because she has that jurisdiction over the Health Insurance Fund, to resolve that question and bring those fees down, not for everybody, but for those who are financially vulnerable in our community.
But do you think it's just the financially vulnerable? I mean, is it possible that, well, I mean, you know, it's going to be, when you need to visit a doctor, the first thing that shouldn't spring to mind, which often does, is, oh gosh, can I, you know, how much is this going to be? And then also if the doctor says come back again in 2 weeks and come back a bit further. I know GPs try and help people where they can and it's a bit more manageable, but would a blanket approach perhaps be better for our health?
Something that we have said in the Jersey Care model we would work through. It's going to take time, but we are starting with addressing it for those who are most financially vulnerable. But we recognise what you say, and we don't want there to be any barriers to seeking healthcare. And it's not just about reducing or cancelling any charge every time you go and see a GP. It's about different ways of delivering care and different ways of supporting GPs and all primary care practitioners. It's a rather old-fashioned way at the moment that you pay a visit, the GP gets paid. There are other ways you can do it by asking the GP to take care of 1,000 residents, and government would pay the GP a lump sum for that responsibility. And the GP will then organise his surgery, employ perhaps a practice nurse and different practitioners to come in, working with hospital consultants. So there's that modern thinking that we are going to be working through as part of the Jersey Care model.
Chief, I'm sure lots of people will be very reassured to hear that, Health Minister. Chief Minister, somebody's asked here about the government plan itself. You know, how does it really help islanders? You know, how many people are actually going to go out and read this?
Yeah. There's a difference between the second part of your question and the first part of your question. How many people will actually go out and read it? I, of course, would be delighted to know that 100,000 people are going to go out and read a 200-page document produced by their government. I somehow doubt that, and that's one of the purposes for these type of meetings that we've been doing, so hopefully to get an idea of what it's all about. How does it help islanders? I think the fundamental point is what we have to do every year by law is this sets out, we have to produce this, and it sets out essentially our budget, what our spending plans are for the next year. We've widened it out so it's not just a numbers place, it's also about the intentions and the actions we want to take, and that is all about helping islanders. And just to give a range, and I was just scribbling some notes because I'd seen the comment coming up on Slido, this is about supporting the spend that we do on Brexit, for example. It builds on our plans, We build on our plans that we put in place for 2020, and it maintains those plans where we can, and obviously then there's some additional bits and pieces. So as I said, we're building on Brexit. Last year in 2019, it funded what's called the Let's Be Honest social worker recruitment campaign, which basically produced an extra 22 new social workers, which obviously helped that area, and that was about getting more permanent resource in there. And if it hadn't been for COVID, we'd have been carrying that on more. We again talked about again last year and happening during this year in terms of mental health, which was quite an important issue at elections, about the listing lounge, about complex trauma, mental health legislation the health minister brought through, and we began work on the £7.3 million improvement up at Clinic Pinnell at St Saviour's Hospital. Obviously last year we launched the whole carbon neutral strategy, and this year we've got the new wildlife law. I'm giving a broad range of kind of events. We've got in the government plan for this year, it's about the census for next year and funding it, and that obviously takes us into what is the population, assists us in terms of migration policy. What the government does, and it's one of the things I wanted to do pre-COVID, it's been delayed, was to give an indication what government actually does on the island. And if you stand back and say it's everything from maintaining the roads to the sea defences to supporting the economy and supporting islanders, you know, those £100 vouchers didn't come out by accident. So ultimately, it's about supporting the economy, supporting islanders, supporting their health, supporting the environment. Obviously, we've in with all that said we're putting children first as well, because of all the reasons we should be familiar with. That's how it helps islanders. And essentially, it's the bedrock that says, this is the strategy for the next year, this is the funding. If this is approved, go ahead, and then it gets implemented. And there's measures in there that say how we're held to account on it, how we're measuring against on performance. And obviously with COVID, it's been an incredibly challenging year. But ultimately the government plan is about our future spending plans and about trying to improve things for islanders, improving the services we've got, some of them really unexciting. You know, why would we want to spend the amount of money we spend on IT? Well, as I said in earlier parts this week, possibly when you were here, I can't remember, I'd never even heard of Teams probably this time last year. And Teams, by the way, is a Microsoft product that we now use. That by the rollout
that's
that
one of
we
these
did,
virtual things that people use for meetings and
exactly,
we can talk
for
through computers, like Skype. Yeah.
And we rolled that out as part of what's called Office 365, where we were actually being criticised this time last year for the amount of money we were spending on IT. Actually, it's allowed, some islanders may not agree that this is a good thing, but it allowed the States Assembly as actually the first full assembly within the British Commonwealth to meet properly and fully with full debates and questions, all that type of stuff. And that was it was again a Commonwealth first. That has allowed us to get the legislation in place for COVID properly, with debate, with briefings to states members, to allow us then to put the enforcement measures in, and also to do the measures that we put in place to support business and support islanders' jobs. So therefore, in here, we continue to spend on our IT. If you go back to, I'm using that as an example because it's not, people wonder why on earth. If you go back to, I can't remember if it was last year or the year before, the WannaCry attacks in the UK, I think shut down the NHS to the extent that 30,000 operations were cancelled. What we're doing is trying to put that resilience in place to make sure that our systems and our services that we operate are actually fit for purpose for the 21st century. So that is all about, it is about islanders and this island.
Okay, so that's what people will find when they pick it up and read it.
If they wish to.
If they wish to. Now, somebody's asked an interesting question here. When I keep promoting Slido, it comes up on the screen, and there's a question at the top here. Now, it might be a difficult one, but responding to COVID, many people are concerned about the long-term effects of a vaccine that changes the DNA, in particular birth defects. Please advise. Is that true? Does a vaccine change somebody's DNA?
I don't believe that can be true, because this has gone through so many tests, not just in the UK, but throughout the world. Authorities throughout the world and universities have been undertaking so many studies on this, and as a result, these vaccines have come through and been assessed as safe. So I think that is not true. I believe it would be not true, because if it were, then they would not have passed the safety tests that have been conducted. So I'd urge people not to just accept what might be being put out there on social media or other channels, but just to really go to a reliable source of information and judge for themselves.
Somebody else has asked here, on the subject, sticking with the vaccines, what's the plan for those who get community support, i.e. for autism, or they live alone and they rely on that support? Where do they fall in the vaccine priority?
So there will be some vulnerable people that we won't ask to come up to Fort Regent and go through the process there, but we will have a mobile team that can deliver the vaccine to their home or wherever they are staying. So we are able to respond to individual need like that.
Constable Norman, possibly for yourself here, Jersey's testing regime has led the world. Yesterday, the UK announced a reduced isolation with paid-for testing. Could Jersey follow and help hundreds of people return home for Christmas?
Well, we have changed the testing regime, and now if you stay in a red area before you come back, then you have a 10-day isolation with three tests during that period. But I mean, we I keep using this word vigilant. We've got to try and keep the population safe, particularly for those who are more vulnerable, those who have underlying health conditions, and those who are elderly, who would suffer much greater than those in the other groups. So I'm certainly not at this stage would be looking to try and reduce the impact of local testing.
Oh, the
yes.
question asks, is Jersey following? In fact, Jersey's leading. It's Jersey that's been doing the testing, not the UK, on their arrivals. So we have that tests in place. No person arriving at the port has to pay for it. And we test them, and they have to isolate until the required period, usually 10 days now.
Yep, fair point. I mean, if we're following the UK government with regards to the vaccination advice, somebody's asked here, what about, why is Jersey not also perhaps considering the tiered approach like the UK is in now? Are we too small for that kind of approach?
Yes, I would say we are a single community, aren't we? We're 100,000 people. You can't say that St. Juan would have a different rule to St. Brelard or town. We travel into town, we travel around the island. I couldn't see, and we've never been advised in that way.
How do you stop people travelling around the island? I mean, we could keep everyone in St. Juan, I suppose, build a wall around it, but I don't think that'd go down terribly well with Richard Buchanan.
Well, we might want to keep you out.
You might well do, Richard. Yeah.
I mean, I suppose we're coming up to the final 2 minutes now, and there's a question here that's come in from somebody who said, and this might sum up and be kind of a good final message for us here. Somebody said they've just been out for a drink in town, and the establishment was rammed busy, no social distancing, and no one's asking to collect the personal details. Surely a second wave is approaching. I mean, what's your response or reaction to that briefly? All of you, I suppose. Let's start with you, Len.
Well,
Sorry, Constable Norman.
If it is true, and I accept what your caller is saying, that is appalling and irresponsible. And we saw what happened to one establishment who was irresponsible and appalling, and they found themselves in front of the licensing bench with not just a £20,000 fine, but a threat if this happened again, they could well be closed down. Okay. So there is a potential sanction.
And presumably, Health Minister, people themselves have a job a role to play in that as well, whether they choose to go into an establishment that's already busy.
Yes, please. So if you see a situation like that, don't go in. Don't expose yourself to risk. But if that person would find a way of identifying the establishment, they could go onto the helpline or notisolating.gov.uk or use any of our private emails, we can ensure that that establishment will be investigated, because it is appalling.
And visited.
And visited, yes. Yes.
Is that what you're going to say, Chief Minister, as well?
Well, I was going to say two things.
Yep.
One is absolutely that. It's all about community responsibility, and I think Richard and Len have summed it up. What I did want to do, which has nothing to do with the question, is I say, on the basis it's our last night here, is just to say, well, thank you to you and to Gary for hosting this, but can we just say thanks as well to all the people who are behind the cameras, and also, particularly as they sometimes get ignored and underrated. I've talked about what was in the government plan about the services that the public see. What the public don't see, and what sometimes people like to denigrate, are people like the Comms Department and like the what we call the MSU, the Ministerial Support Unit, who are actually all the people behind this that help put these type of events together. And just to give an example for me, I pre-COVID, this is an estimate. We reckon I get about 73,000 emails a year, and so to do that and to get the responses out to people, and that can be queries, it can be appointments, it can be reports. There's a team behind me who support that, and obviously today and tonight to get this set up in place, and even all the other campaigns that we've been doing, as you will know, the communications department behind us do a huge amount of sterling work. Sometimes that's not recognised. Do want to really say thank you to everyone who's helped put us together for tonight and for this last week, and thanks to everyone again for the support that even in the last few weeks we've been having. It's never acknowledged. It is often underrated, and actually we do appreciate it.
Right, well, thank you, Chief Minister, and thank you for stealing my ending, because I was going to thank everybody as well, so you've done that for me, so that's fantastic. Thank you to the ministers here, thank you to all of the ministers who appeared all week, but most importantly of all, thank you to you at home who have been sending in your questions. Apologies if we haven't managed to get round to all of them. Who knows, we might be here again one day doing this all over again. But in the meantime, have a great weekend and stay safe.